India is urbanizing consistently. Rural areas are changing into towns and towns into large cities. This throws new challenges for city administration in terms of provision of basic services. Along with the requirement of investments into these cities, city managers and administrators require quality data to be able to make informed decisions. The Performance Assessment System PASS is a 7-year action research project implemented by CEPT University and the Urban Management Centre in Gujarat and All India Institute of Local Self-Government in Maharashtra. PASS aims to develop better information on water and sanitation services in all 400 plus cities in these two states. The PASS program has three main components of performance measurement, performance monitoring and performance improvement. Key performance indicators for the water supply, sanitation, solid waste management sectors for the past 5 years have been collected and is now available online.
There is a lot of information which was lying in the files in a particular city. It's now out in the open. It's out in the public domain. And I think the whole purpose is that we want the future investments in infrastructure to be well informed.
In addition to the Government of India's service level benchmarks, the PASS project also collects information on access to services in slums and on-site sanitation systems. The PASS assessment framework also generates local action indicators that help cities to take actions towards improvement.
Framework has been recognized all over by Government of India, and now Government of India wants PASS project and CEPT to take it to other states in the country.
In the initial years, the process of information collection was arduous. UMC teams visited each of the 167 cities to inform the city managers about the need for performance assessment and collect data on the existing water sanitation systems. The team spent 2 to 3 days in each city, helping them collect data from existing registers and logbooks into spreadsheet-based formats. The UMC teams also validated this data by visiting water sanitation utilities including water sources, water treatment plants, water distribution stations, wastewater treatment plants and solid waste dumping sites. The team also used this opportunity to spatially map all these utilities. Since most cities did not have base maps, the team mapped available data on aerial images. A standard legend with specific color codes was developed for mapping. These maps were also shared with the cities and have proved to be a useful resource. For information system improvements, the team also collected copies of formats, logbooks and manual registers maintained by the cities. The indicators thus generated were further validated with cities' executive and elected officials. The exercise for collecting data for the first year took almost 15 months to validate and complete. City officials appreciated the emphasis on ground-level research and consultative approach of the PASS program. Equity being a key theme of the PASS program, the UMC team also surveyed each and every slum settlement in municipalities of Gujarat to assess the water and sanitation situation.
So this data collection and analysis of water sanitation sector over the years has made us realize the goods and the shortcomings. For instance, whereas cities have improved water coverage over the years, we have realized that cities need to do much more to reduce leakages, reduce illegal connections and hence reduce non-revenue water.
The city visits for collecting data for 3 years familiarized the city officials with the pass indicator framework and data requirements. It also ensured that the UMC team had a strong baseline data and an understanding of reliability of data across sectors. Data for the fourth year was then collected through a centralized data collection process at Gandhinagar, spread over a month. Officials from different cities came to Gandhinagar with the required data in files as per a pre-decided schedule. This data was entered in an online data portal developed under the PASS project. The tool is hosted on the PASS portal www.pass.org.in. From the fifth year onwards, the PASS team ensured that all cities fill data on the portal themselves and assess their own performance. Hands-on trainings were organized in clusters to cover all 167 cities, during which the city staff filled the data themselves. Here, the PASS team shared a comparative analysis of cities with their peers. The city officials showed keen interest to understand their performance in comparison with their peers. This training proved useful for the city officials, and almost 100 cities filled data online themselves with minimal support of the UMC team.
The rigor and the systems established under the PASS program has led cities to evolve their methods of data collection and record keeping. The city governments use this data to make appropriate and timely decisions. The state government, when receives this data, would also look at it and make planning and policy interventions.
With such a robust database available at various scales, ranging from a ward to a district to the state level, cities and the state level bodies can now make informed decisions to improve service delivery and to ensure access to each and every citizen.